Good morning, everybody. Welcome to the Hellenic Home for the Aged. My name is John Fanaras, and I'm the President and the Chair of the Board of Directors of the Hellenic Home. It is our distinct pleasure and honor to welcome today to our facility our distinguished guests. Honorable Rod Phillips, Minister of Long-Term Care and MPP of Ajax, Honorable Jill Dunlop, Minister of Colleges and Universities and MPP Simcoe North, Ms. Dianne Martin, Chief Executive Officer of WeRPN, Ms. Linda Franklin, President and CEO of Colleges of Ontario, Your Eminence, Archbishop Sotirios, Ms. Irene Dotsikas, President of the Hellenic Home Ladies Auxiliary and ex officio board member, and Ms. Effie Triantafilopoulos, Parliamentary Assistant to the Ministry of Long-Term Care. I would also like to acknowledge and welcome the senior staff of the Hellenic Home that are with us this morning. Kosta Kostouros, Chief Executive Officer of Home, Chitra Persod, Chief Financial Officer of Hellenic Home for the Aged, Nicholas Georgandonis, Administrator, Hellenic Care for Seniors, Marilyn Kitsidis, Administrator Housing, Polly Pergandis, Administrator Scarborough, Kathy Smilis, Director of Care, Hellenic Home for Seniors, and Mary Madarang, Director of Care, Scarborough. The Hellenic Home for the Aged is a non-profit organization dedicated to providing exceptional quality care and services to the seniors in our community and enhance their physical, mental, emotional, and spiritual health. By staying at the front of our community for ever-changing needs, our services are second to none. Our seniors live in a nurturing environment that respects, enhances, and promotes their dignity, independence, and happiness. The home offers a unique cultural setting, one that is proud to recognize the customs and traditions of our residents who are of predominantly Greek ethnic background, but with a long-standing commitment to provide for the needs of individuals from diverse backgrounds. The home operates 2 long-term care facilities, 2 chapels for the spiritual needs of our residents and tenants in Toronto and Scarborough. In addition, the home offers 225 independent living seniors apartments on this location and an adult program that accommodates up to 12 clients. Our long-term care sector went through very turbulent times in the past 20 months. COVID-19 magnified the architectural, engineering, and human capital shortfalls in long-term care, and even though our staff worked heroically to keep our residents safe, many succumbed to the virus. I would like to extend our gratitude to our frontline workers for their tremendous care and work during these times. These are people that truly care and go beyond their call of duty. Till now, our sector worked with what it had to make ends meet. We all know they were not enough. Furthermore, our society is aging, and our waiting list of 550 applicants for these 2 nursing homes is growing. Our residents' profile has changed dramatically in the last 5 to 10 years, requiring heavier care. My generation, I'm a baby boomer, is aging and is not being adequately replenished. And finally, COVID was the unfortunate event that created a defining moment for change. We are more appreciative to the Premier Ford, the Government of Ontario, and Minister Phillips for supporting us through the pandemic and for their leadership in identifying the shortfalls, committing the resources, and outlining the roadmap to improve long-term care. Pandemic prevention and containment funding, wage enhancements in an effort to retain staff, vaccines mandate, staffing increase funding, education funding, and incentives for new graduates to work in our industry, call for new beds, a new Long-Term Care Act that will hopefully steer away from the current punitive nature, while at the same time increase transparency and accountability. Doubling the number of inspectors are some of the initiatives our sector is most appreciative for our engaged government. Minister Phillips, we embrace and are most appreciative of our commitment to identify our stressors, whether those are structural design, environmental capacity, human capital, or policy. We look up to your leadership and innovation and look forward to continue working with you for more beds, construction financing opportunities, and to inspire young Canadians to want to work in our sector and attract and retain qualified employees. This will allow us the opportunity to provide for our most frail to live with dignity and respect and get the care that they deserve always. It is now my distinct pleasure and honor to welcome to the Hellenic Home and to the podium the Honourable Rod Phillips, Minister of Long Care.
Thank you so much, John, for that kind introduction. And thank you to yourself, to the Hellenic Home's team here with us today, and those that are working as well. They are a fantastic example. This organization has served Toronto seniors for over 4 decades. It is an example of a home that offers care in a unique cultural setting and recognizing the customs and traditions of your residents with Greek background, while also caring for the needs of individuals of diverse backgrounds. As I was saying to His Eminence and your team before, Hellenic Homes is one of the great opportunities for us to learn, for the sector to learn about how to serve unique cultural communities. I'm also so pleased to be joined by my colleague Jill Dunlop, the Minister of Colleges and Universities, and my colleague, the MPP Effie Triantafilopoulos, Parliamentary Assistant to the Long-Term Care Minister. Thank you also to Dianne Martin, CEO of WeRPN, Linda Franken, President and CEO of Colleges Ontario, for their partnership. And of course, I'd like to thank my friend, His Eminence, the Archbishop, Sotirios, for honoring us with his presence here today. It is always, Your Eminence, a pleasure to be in your presence. After decades of neglect, our government continues to take action to fix Ontario's long-term care sector. As you heard from John, we have a plan to fix long-term care and to ensure Ontario's seniors get the quality of care they need and deserve, both now and in the future. That plan is built on 3 pillars: staffing and care, accountability, enforcement and transparency, and building modern, safe, comfortable homes for our seniors. Seniors entering long-term care today are older and have more complex medical needs than they did just a decade ago. And the level of care those residents need has increased dramatically, but the amount of care they receive each day has not kept up. In fact, between 2009 and 2018, the amount of care each resident received per day increased by only 22 minutes. Our government has committed to ensuring residents receive, on average, 4 hours of direct care per day over 4 years from nurses, RPNs, and personal support workers. That means increasing the average daily care by 1 hour and 22 minutes just over the next 4 years. This will be the law with the introduction of our new legislation, and this will make Ontario a leader in Canada. To make this a reality, tens of thousands of new staff need to be trained and hired, and that is why we are here today. That's why we released our multi-year staffing plan last December, in which we committed to invest $4.9 billion over the next 4 years to hire more than 27,000 staff that are needed to reach the 4 hours of care target. Now, we know that more staff means more care, but finding and retaining those staff can be a challenge. That is why I'm pleased to announce that today our government is investing an additional $100 million over the next 4 years to add 2,000 additional registered practical nurses and registered nurses to the long-term care workforce. We will do this by attracting PSWs and registered practical nurses to long-term care and help them to take the next step in their careers. This investment will be supported by 2 complementary programs that I'm going to describe. The first will help attract staff to long-term care and support them to further their education. The second ensures that the courses they need are available for them and always appreciates the reality of the busy lives that our frontline healthcare workers live. We are working with the Registered Practical Nurses Association of Ontario on the first part of this plan and investing $62.5 million in the Bridging Education Grant in Nursing program. This is a program personal support workers to train personal support workers to become registered practical nurses and registered practical nurses to train them to become registered nurses so that they will be able to cover both their tuitions and other costs. In exchange, participants will work in the long-term care sector for the same amount of time they receive the support. This support includes paying up to $6,000 per year for personal support workers, staking registered practical nursing programs, and up to $10,000 per year for registered practical nurses bridging into registered nursing programs. The Bridging Education Grant in Nursing program also includes wraparound support of up to $5,000 per year to support additional financial needs like the cost of course materials, tutoring, childcare, and travel. This support will help address barriers people face when they want to further their education, and it's a win-win scenario. More staff for long-term care, more educational and career opportunities for staff in long-term care. We know that PSWs and RPNs are busy, hardworking people. We want to make sure that they can take advantage of this opportunity and understand that traditional college class might not be possible given their schedules. That is why, for our second investment, we are working with Colleges Ontario and investing up to $38.3 million to transform nursing programs. This investment will fund the development of programs for PSWs, RPNs, and internationally educated nurses looking to upgrade their skills and grow their careers. These programs will be offered in English and French and will feature a combination of online and in-person learning, which provides more flexibility for people to learn on their own schedules. Together, this $100 million investment will add more than 2,000 nursing graduates to the long-term care sector by 2025. These programs are part of the first pillar of our plan to fix long-term care, improving the care. To further improve staffing and care, we will be launching a promotional campaign to attract more people to great careers in the long-term care workforce. Equally important are the other two pillars of our plan: building safe, modern, and comfortable beds for seniors to call home, and strengthening accountability, enforcement, and transparency in the long-term care system. Yesterday, I announced our new and improved inspection program, which includes ramping up proactive inspections and doubling the number of inspectors in the province. Tomorrow, I will introduce legislation that seeks to fix long-term care by improving well-being of residents and ensuring that they get the care they deserve. We are making progress on every pillar of our plan to fix long-term care, and we will continue to do whatever it takes to make sure that the long-term care system is fixed for our seniors and that it is the best place for them now and in the future, for their quality of life and for their care. It's now my pleasure to turn the podium over to Minister Dunlop.
Thank you, Minister Phillips. I appreciate the opportunity to be here today at Hellenic Home for the Aged with Minister Phillips to announce this critical investment to help Ontario's nurses and personal support workers advance their careers. As Minister Phillips has outlined, the nursing program transformation in Ontario's colleges will increase access to nursing programs at public colleges by creating an additional 500 enrollments in bridging programs for the 2022-23 academic year. Through new hybrid online and in-person education in practical nursing and Bachelor of Science in Nursing programs, personal support workers who have graduated and registered practical nurses will be able to build on their existing skills and credentials. This program also offers financial support of up to $6,000 a year for internationally trained nurses to gain required credentials to work in Ontario through competency upgrade programs at publicly assisted colleges. The end result of both of these innovative programs announced today will be thousands of personal support workers and nurses who will be able to move on to the next stages of their careers in the long-term care and other healthcare settings. Ontario's publicly assisted colleges, universities, and private career colleges play such an important role in educating individuals needed in our communities and long-term care facilities. graduating personal support workers, nurses, and other healthcare professionals to care for our loved ones. Earlier this year, we announced a number of initiatives to help grow the supply of frontline healthcare workers. In the spring, we partnered with our publicly assisted colleges and Colleges Ontario to create a rapid training program to support the training of up to 8,200 PSWs for high-demand jobs in Ontario's health and long-term care sectors. The first graduates of this accelerated program will be ready to work in long-term care and other healthcare settings this fall. We also introduced an initiative to train up to 4,000 new PSWs through private career college programs who will start graduating this November. Ontario's personal support workers and nurses are some of the finest healthcare practitioners in the world, and that is a great testament to the education they receive through Ontario's colleges, universities, and private career colleges. And because we need more registered nurses and registered practical nurses in Ontario, we're also providing funding to support the expansion of enrollment in nursing education programs at publicly assisted colleges and universities across Ontario. Additional spaces for the available for fall 2021 and winter 2022 cohorts, and will introduce approximately 1,130 additional practical nursing graduates and 870 Bachelor of Nursing graduates into the healthcare system. We also recently announced our support for new innovative training and hands-on learning opportunities for French language nursing students in Ottawa so they can continue to receive world-class education during the COVID-19 pandemic. And just yesterday, we announced funding for the Learning Interprofessionally Healthcare Accelerator, a virtual simulation and game-based learning program that will be provided free to all of Ontario's long-term care providers and students training to work in long-term care as PSWs or nurses. All of these investments support the government's commitment to increasing our supply of frontline healthcare workers. Through innovative partnerships demonstrated through these two programs today, we're reinforcing our commitment to fix long-term care so that our loved ones get the quality of care they deserve today and always. Thank you so much, and now I'd like to pass it over to Archbishop Sotirios.
Ministers, Mr. President, ladies and gentlemen, I always say that the seniors are our mothers and our fathers. And I always say that we should take better care of them than we take care of ourselves. When we were babies, they worked for us. I come often to this place here, and today I would like to congratulate the staff, the President, and everybody else for a wonderful work that they are doing. I have been working with senior people that I have placed them in places that are government assisted and not government assistant. And I have seen a great difference. And I think all the governments must do their best to have all the senior citizens in places that are assisted by the government. I know and I have seen what you have done, and I thank Minister Phillips and my friend Premier Ford for they are honest people and they are trying their best. But I will not stop always saying that we must have senior citizens' homes assisted by the government for everyone. And this is something that I always will do. I don't know how to do it, but the governments should take care of this. This is the only message that I would like to say. And again, I would like to say that they are our mothers and fathers, and we must take excellent care of them, better care than we take for ourselves. Thank you, the Home for the Aged here. Thank the ministers, and thank my friend Premier Ford for, I think they are doing an honest job, and they will do more. Thank you very much.
Thank you, Minister Phillips and Minister Dunlop, for the invitation to join you today for this important announcement. As the CEO of WeRPN, Dianne Martin is my name, the professional voice of Ontario's practical nurses is our role, and I can confidently say that today is a great day, not only for the nursing profession, but even more importantly, for the residents in long-term care. Nurses have been experiencing nursing shortages and the impact that this has had on nursing care for some time. This $100 million investment is a game changer. It will ensure that Ontario has an endurable supply of nurses to meet the increasingly complex needs of our aging population. It will also create new and more accessible pathways for PSWs and RPNs to take part in rewarding career growth that retains them in the profession for life, creating strong professionals with invaluable experience. I teach a class of RPN to RN bridging right now, and the quality of care that they bring to the RN role because of their RPN experience is exemplary. I'm the product of career laddering, and I have with me today here our president of our association, but also a nurse who, Jackie, Suzanne's our president, Jackie career laddered from PSW to RPN, Victoria career laddered from RPN to RN, and we have our very own student board member here who is graduating as an RPN in minutes from Fleming College. So I'm very proud of the work that is done by these people and the importance of their ongoing education. Nursing is one of the most respected professions in Canada, and yet in the past, PSWs and RPNs who have wished to career ladder have faced financial barriers as well as barriers to access, and they often choose to leave healthcare altogether for more accessible and affordable career paths. They demonstrate such resilience, especially in times of, lately, in times of such pressures and times that we have been facing. This Bridging Educational Grant in Nursing, or BEGIN, great acronym by the way, initiative, together with other government programs improving access to education, will offer these dedicated individuals new opportunities for meaningful and challenging careers in healthcare. And possibly the most important aspect of the BEGIN program is that many will continue to work in their current role as they study. This will bring stability to the sector, the long-term care sector, while growing our nursing supply, and long-term care facilities will have the number of nurses they need to deliver the kind of care that our long-term residents deserve. And possibly, for the first time, nursing in long-term care will be up front and center as a desirable place to work. As an organization, we could not be more thrilled with today's announcement and look forward to working with the government to deliver this important initiative that will have such a profound impact on Ontario's nurses and our health system. Thank you again, Minister Phillips, for choosing WeRPN as your partner for the Bridging Educational Program in Nursing.
Well, thanks, Dianne, and thank you for inviting me to be here. I'm Linda Franklin. I'm the President and CEO of Colleges Ontario, and I couldn't be more thrilled to be here for this terrific announcement. Today's news will create many exciting new opportunities, as you've heard, for healthcare professionals to advance in their careers, and in doing so, support the needs of our long-term care sector. It will allow nurses and other health professionals to strengthen their qualifications and further enhance the quality of care they deliver, but in ways that fit their busy lives, which is so critically important today. You know, throughout the pandemic, we've all come to really appreciate the critical importance of our healthcare workforce. And at Ontario colleges, we're very proud of our role in training the healthcare workers of the future: nurses, personal support workers, paramedics, healthcare executives, and so many more. But we're equally proud of our ability to offer programs that help mid-career students come back and get additional qualifications without having the tremendous challenge of leaving work, often for a few years. This announcement is a perfect fit for colleges and our capacity to bridge workers to higher credentials. We are truly grateful for the strong support and recognition we've received and continue to receive from Ministers Dunlop, Phillips, and the Ontario government. The government has made huge investments in healthcare programs at our colleges. For example, the $115 million announced earlier this year that Minister Dunlop referenced to support the creation of accelerated PSW programs, which allowed us to train over 8,000 new PSW workers this year alone. The government has also helped us address the demand for more nurses by allowing colleges to create their own 4-year nursing degree programs. This was a huge breakthrough in healthcare education, and it encourages more students to enroll in nursing because it allows them to complete all of their studies in their home communities, which further encourages them to stay in those local communities and work. You know, as soon as Dianne Martin heard that announcement, she came right over to me and told me, Pathways is our next goal. And here we are, helping to solve for that challenge today. I'm just thrilled at this government announcement, and in closing, again, I want to sincerely thank the ministers for this announcement, and I want to commit the entire Ontario college system to helping the government achieve the goals of this critical initiative. Thank you very much.
I'm also very pleased to join you with my colleagues for this great announcement about career growth for nurses and personal support workers at the Hellenic Home here in Toronto. It's an honor to have His Eminence Archbishop Sotirios with us, the spiritual leader of our Greek Orthodox community. This announcement is another important part of how our government is fixing Ontario's long-term care system. I'm proud that we are investing up to $100 million in training for personal support workers and nurses to advance their careers in long-term care. We know that more staff means more care for residents, and it's why our government is offering PSWs up to $6,000 a year and eligible registered practical nurses up to $10,000 a year in financial support. This means another 2,000 nurses will join long-term care by 2025, offering quality, compassionate care to residents. In the 3 years that I've served as parliamentary assistant for long-term care, I've had the chance to meet residents, families, and many of the staff across Ontario. I know that this announcement will help to make their working lives better, encouraging them to stay in long-term care as a career. I'm also pleased that this announcement is taking place here at the Hellenic Home. This home is very dear to my heart. Some of you may know that my aunt was one of the earliest residents, and as her primary caregiver, I was here on a weekly basis. I've seen the loving care that the staff provides to the residents. I know that the 2 Hellenic homes are regarded as jewels in our Hellenic community, providing excellent care for residents, while allowing them to live in an environment that includes their language, culture, and faith. We know that many residents are more comfortable in their mother tongue as they age. The Hellenic Home has been caring for residents for more than 30 years, along with providing assisted living. It's an early example of a campus of care. They are truly role models and provide a standard of care that we can all be proud of. And this year, I'm proud that our government provided $13 million for a new 128-bed Hellenic Home to be built, the 3rd for our seniors community. As a government, we are making great strides in fixing long-term care for everyone. It's a great day for residents, families, and all the hardworking staff. Thank you for the compassionate and excellent care you have provided our seniors over 30+ years. I'd now like to call on both ministers to come forward, should there be any questions from the media.
Thanks, Effie, and thanks, everyone. Any?
First question.
Minister, good morning. Jamie with City TV. Minister, yesterday we heard that in the House the Minister of Education give a percentage of a number of people that work in the education system that don't have or haven't submitted their vaccination status, whether they're vaccinated one shot or. In your ministry, in long-term care, how many, what's the percentage and the number of people that haven't submitted or been fully vaccinated?
So Jamie, thank you for the question. We track that information on a month-by-month basis. I inquired, I have to admit, here at the Hellenic Homes, and they were at 100% here, which I congratulate the staff and thank them for their care. We were at the last tracking, which was for the month of September, was at 94%. We'll get the new data, and as we've committed to, we'll make that data public. So we'll see as we get closer to the November 15th timeline where those numbers go. But I think in general, we have to remember that about half of the sector had made a decision about having a mandate prior to our direction. And for those homes, they tended to receive 97, 98%, in some cases 100%. So we monitor it closely on a by-home basis, and we'll make that information available for the month of October in the first couple of weeks of November.
And then that 6% of the people, what's going to happen come the deadline?
Well, Jamie, we're very clear on October 1st when I issued the mandate is that to work in a long-term care home, to volunteer in a long-term care home, you're going to have to be double vaccinated. So we will work with the homes if there are challenges from a staffing point of view. But again, I'm very optimistic, including today, hearing from the management here about 100% vaccination rate. And obviously, we're working with public health to make sure there are clinics, there's education, all the information that healthcare workers need. And I'll take the opportunity to say to all healthcare workers, and particularly those in long-term care, thank you for the steps you've taken in terms of getting vaccinated. It's the best way to protect our most vulnerable.
And the question is, so if a person hearing this announcement saying, I've always dreamt of being working in this environment, immediately what they can do to get their pathway or get their career on the go to long-term care?
So the information about today's announcement will be available on the government website in terms of the details of how to apply for the support. As I mentioned, however, though, we are going to be putting a full press on, including a promotional campaign, to inform people about the fantastic opportunities there are for careers in long-term care. When I speak to PSW students, and I know Minister Dunlop does as well, I'll often say, how many of you, for example, would like to be a nurse, an RPN or a nurse someday? And many, many will put up their hands. I also say, how many of you are foreign trained nurses? You have an education outside of Ontario. Many, many will put up their hands. So this $100 million will provide that ladder, and we want everyone in Ontario who's interested in a career in long-term care or the health sector to take advantage of this.
Next question.
Great.
There being no further questions, I'd like to thank everyone for coming out today.
Great. Thank you very much, everybody. Thank you.